Art, let's talk about the future of healthcare. Obviously, you've had over 30 years in healthcare, 25 as managing director at Deloitte. You've been focusing on building AI directly into health plan apps, claims, utilization management, provider systems. We're talking about automation. What do people get wrong about this? How do you see the future of work in healthcare?
Good question. I think, if you just think about kind of backing up to where Rajiv even started, right? The cost of labor in the market, right, is about $4 trillion in just healthcare itself. And then that management and coordination layer that he pointed to is somewhere in the, trillion to trillion and a half number. So staggering numbers. And that's healthcare, that's, nurses, doctors, also, on the health plan side, a ton of clinicians, a lot of people that just doing a lot of administrative things and aren't really working at what I like to think of as the top of their license, which is really, I think, what this is about.
I know you love that phrase.
I do.
What do you mean they're not working at the top of their license? So what happens? Are they replaced? I mean, we just saw token costs go from 1.2 million to 7 million year over year. But where's the ROI? That's the other side of this. Are we just spending the money and then not seeing the results?
Uh, I don't know if, I think there's some results there. I mean, we've had good outcomes. I think it depends on just wh where you go then and how do you pinpoint kind of the place. I mean, have you used like GPT Health?
Yes. And I definitely want to talk about that. I have used it.
So
Very
you're you're
powerful.
you're one of, 40 million people a day who's using it. It's like 5% of all of the
Right.
requests on GPT. So powerful tool, potentially. Also, potentially a place to drive a lot of cost, right? Because just imagine if the GPT gives you the highest cost, solution to every medical problem. You go ahead, you sprained your ankle, you
Mhm.
go get an MRI, pick the thing, right? Set lots of doctors.
Yep.
So it drives you really to a place where you could really see cost escalating very, very quickly.
I told it that my bunion hurt and it said you should go get an MRI. And I was looking this up. This is pretty mind-blowing, but it says that according to University of Oxford, nearly half the time AI chatbots like ChatGPT Health give inaccurate or incomplete medical advice, frequently under triaging emergencies or suggesting wrong dosages. That sounds dangerous.
And they even tried to bound the models significantly to say don't give advice, and people just continued to do it. So I hope your MRI goes great, but I mean you can see the cost problem,
I don't really need
right?
one.
You can see the cost problem, you can see the utilization problem, and I think that's really the question of how are payers going to react to this? How is the world? Maybe it's not a payer, right? Who's going to react to this navigation to the right source using these tools? There's clearly a gap, right? Everybody's using it, so there's something missing in the system today that can direct a human to go to get the right care at the right place, at the right time. We know how to do it. Like the rules are there, but there's the opportunity now is the signals underneath that can really drive you to the proper outcome in a coordinated way with the risk and the transaction and all of the navigation that a payer has to today. Somebody has to kind of manage that stack.
Mm. Right. In looking at these publicly traded payers, and we're talking United,
Yeah.
Humana, Cigna, et cetera, they were outperforming the S&P by a wide margin right up until 2024, and then the bottom fell out. So if you look at, you're saying one of these payers could emerge as a trillion-dollar company if they get this right, what would that look like?
I mean, that's what it is, right? That it's seeing all of the moving parts, right? So there's, like I said, three components of it, right? They deal with transaction at the bottom layer. There's a layer of risk that they manage, and then it's the navigation of the human through the health system, which they're actually pretty good at. But as this kind of gets decoupled now because GPT is giving all the navigation directly from the other pieces, there's some that break has to be corrected, and that's there's ways to do it, and I think that's really where the opportunity lies. And really is I think what Signal Labs is building that could really help pull those pieces back together and coordinate it appropriately. Does that make sense? You did good.
Absolutely.
You did some really good research here.
Always.